How is technology advancing?
So this is another device that comes from the same company, and this is an in-office stent, a little different in shape. It goes up in the ethmoid cavity, has its own little deploying device as well, and this is used in patients that develop polyps, a real tough group of patients who have chronic rhinosinusitis. Their nasal lining is more inflammatory than even the bad sinus patients, and their rate of recurrence of polyps is 80% or more. And so this device can be put into the sinus cavity. It's different. It stays in and leaks drug out for 90 days. So for 3 months, you get steroids in the lining. Doesn't go in the body systemically. You don't have any systemic side effects from it, but it's a wonderful little device.
And so that's especially used for people that have the chronic sinus infection with polyps in there, which is really, really quite common because of the inflammation. How long does that stay again?
This device dissolves in 90, or it leaks drug in 90 days and dissolves in about the same time frame. So 3-month device now, 3 times the amount of drug that's in the smaller device, and it's wonderful. This will change the way we practice. We'll begin to offer patients that have polyps an in-office treatment as an option to try to avoid surgery, and the results clinically in trials have been excellent.
To me, that's just fascinating that you can put medicines inside the sinuses instead of every day having to go through steroid washes in that type situation. So at the end of 3 months, do you have the experience of what kind of results that people have?
70% of people see the polyps go away. You see significant reduction in polypoid disease and the symptoms that the patients complain of.
So what do the patients tell you when they no longer have that chronic sinusitis?
They feel great. They have kick in their step again. They're ready to go meet the world and get out and engage. It's a real liberating event for people that have chronic sinus infections. And you know, smart scientists in our country need money and funding for research, and it's from research money that we get these great devices. There is another horizon, I think, that's coming out there for people who have chronic sinus disease. People know about Inbrel and some of the other medications that have been used in rheumatoid arthritis. They may see some advertisements for antibodies that are now used, or biologic medications used in cancer. And actually, we have a new drug that's available, dupilumab, for sinus polyps. And it's a monoclonal antibody, so it's an antibody just like your body makes.
A biologic, we call it.
Right. It's directed against a certain cell or certain chemical called interleukin-4, and it reduces the inflammatory response that leads to polyps. It's, I think, a real horizon in medical management for sinus disease.